Let's dive into today's health talk, which is going to be all about cholesterol. So a lot of us know about high cholesterol. It actually blew my mind researching this, that 1 in 3 adult Canadians struggle with high cholesterol. So very, very relevant and important. And like the other chronic diseases that I get to help people with, obesity, diabetes, blood pressure, a lot of those are silent killers, right? Cholesterol is yet another one where the plaque builds up in our arteries, the cholesterol builds up over time. We tend not to have signs and symptoms until we get to life-threatening things like heart attacks, strokes, kidney damage, artery disease. So that's why it's something that's important to sort of learn about so that you can then manage and prevent it. With me so far? Okay, I wanted to run through some background and some key terms, the blood work that you can do with your family doctor, but also how to interpret those blood tests so you know what the numbers and the terms mean. And of course, then leave you with some actions, tools, and strategies that you can take home with you and do something about it for better health. Sound good? Okay. So the keywords I want to go over, you might hear your doctor use these, you might hear me say them or read about them. Dyslipidemia, hyperlipidemia, and hypercholesterolemia. A lot of mouthful, a lot of jargon. But when you break it down, it starts to make sense. So dys means abnormal or atypical. Lipid refers to fats, fatty compounds, including cholesterols. Emia refers to stuff in our blood. So abnormal levels of fats in our blood. Hyperlipidemia, same idea, too much, elevated, high levels of fats, lipids like cholesterol in our blood. Make sense? And then hypercholesterolemia, same idea, too much cholesterol in the blood. So those are the terms we use, but overall, most people tend to struggle with high or abnormal levels of different types of cholesterol. Your body actually makes its own cholesterol. That's produced in the liver, and that's enough for what we need. Cholesterol is actually not all bad. It's good. It's an essential part of our nutrients. It helps us make hormones and vitamins and plenty of other things. So it's useful to have that for us. The interesting part and where it gets challenging and where the disease comes from is once you add in dietary cholesterol, which even if we're trying our best, a lot of foods that we end up eating knowingly or unknowingly, we end up getting a lot of extra cholesterol from them. Does that make sense? Okay, on to screening and lab work and how to interpret those numbers. So in terms of screening, starting at age 40, we'll do something called a lipid panel, which I'll explain, and we repeat that blood test every 5 years. So that gets us an assessment of kind of where is your cholesterol at to begin with. Now there are times where we'll screen people at younger and earlier ages if they have certain risk factors. So South Asians or Indigenous peoples, their ethnicity is at a higher risk for high cholesterol levels that can start earlier. Family history, specifically of high cholesterol, high triglycerides, that can also be an issue we'd screen for. And then again, those chronic diseases that we talk about, if I have obesity, diabetes, blood pressure, we may also screen earlier because this is another coexisting risk. Does that still make sense? Okay. So when you go to get the lab work done, there are 3 tests we can do. Lipid panel is one I mentioned. The other 2, one is called lipoprotein A and one is called apolipoprotein B. And I want to tell you about each one of those so you know. So your lipid panel, that's the main one that we do. There's 5 different types of cholesterol that you're going to see when you get the results back. Total cholesterol, so all types of cholesterol together. LDL, low density lipoprotein, that's your bad cholesterol. That's the direct one that increases risk of heart attack and stroke and that builds up in the arteries. HDL, high density lipoprotein, the opposite. That's the one that actually mops up the bad cholesterol, and that's the only one that we want to be higher. Right? Then we have triglycerides, another type of cholesterol. That one specifically increases your risk of type 2 diabetes, obesity, other chronic diseases, and contributes to the plaque buildup as well. And finally, you'll see a term on that lab result called non-HDL. That one is simply math. They take the total cholesterol number, subtract the non-HDL cholesterols, so your other 2, LDL and triglycerides, and then they spit out a number. Of those 5, 4 of them, you want them to be lower. Lower is better. The only one you want to be higher, of course, is the good cholesterol, so it can clean up the other ones. So that's test number 1, that's the commonest one you'll do. Test number 2 is lipoprotein A. This test only needs to be done once in someone's lifetime. We don't need to repeat it. Lipoprotein A is a genetic marker, so it tells us what your risk of cholesterol causing heart disease, coronary artery disease, heart attack, and stroke is from a genetic standpoint. So that gives us good baseline information for people. The final one is apolipoprotein B, or sometimes we'll call it ApoB100 or ApoB. That one is something that we can repeat a few more times like the lipid panel, and that it gives us a bit more of a precise or accurate or specific measurement for the risk of the plaque development in the blood vessel if your triglycerides, one from the other panel, are elevated. Still with me? Yeah, okay. Let's go on to the good stuff, stuff that you can actually do, manage, treat, prevent this. As you know, this is again where the pillars of lifestyle medicine really shine. So prioritizing whole foods, high fiber foods, plant foods, regular physical activity, walking of course, try to get moderate or vigorous intensity when you can. Avoiding substances and specifically quitting smoking is a huge way you can reduce your risk for cholesterol buildup and the consequences of that. Getting a good night's sleep, managing stress, all those things that you guys know. The last part is I want to leave you with specific, actionable, nutrition-related things. So these would be things like reading the nutrition label, and this directly applies to cholesterol. When you look at any nutrition label on the back of any package, look for something called percent daily value. We talked about this with sodium as well. When you see, or percent DV it might say, when you go to the cholesterol line for that, if it's less than 5%, it has a little amount of cholesterol for that food. If you're looking at 15% or more, it's far too much and a very high amount. Does that make sense? 3 other small things. You can check out the portfolio diet. That's a specific eating pattern that we use to help people choose foods that naturally eliminate cholesterol buildup in the body, very similar to whole food, plant predominant eating and high fiber focused eating. And then we want to avoid saturated fat. This is the biggest dietary culprit for sure. So this comes from foods, of course, that are like junk foods, fast foods, often deep fried, or certain prepared or packaged foods, ultra processed foods for sure. The one that gets people the most, I think, insidiously is things like fatty cuts of meat, processed or deli meats. They can have high levels of saturated fat. And then also things like palm oil. Coconut oil can be a controversial one because I know a lot of people use that. It's great for the skin, but not good for ingestion. And again, high saturated fat levels, partially hydrogenated margarine, lots of different things. But these are some common foods, right? And the last one I would say is full fat dairy. Butter, cheese, yogurt, especially the very high fat content ones, you're getting unfortunately saturated fat from those. Last thing, eat more unsaturated fats. So those are the opposite kind that can be in the diet that are healthy. I'll talk about this more later, but there's mono unsaturated, things like avocados or nuts. And then there's poly unsaturated, your omegas, 3s and 6s. And those are gonna be things like fish, flax seeds, even tofu has a little bit of that. Does that make sense? Excellent. I'm gonna leave it there. I'll take questions as always, and then we'll take our photo and get on our way. Sound good? Question.
Drugs associated with lowering cholesterol?
Fantastic question. The one line I missed. There are absolutely. So the commonest medication class is called statins.
Okay.
And there are some alternatives to statins. And now we have a few medications that are actually stronger than statins. And the main time, well, we use them very commonly, but one of the best indications for us to be using them is when people have that genetic risk. So if we measure the lipoprotein A, or if you've got an immediate family member with early onset heart disease under age 50, for example, those would be reasons where cholesterol is a funny thing where it's like lifestyle really matters, choices and behaviors really matter, but sometimes it's just not enough. And so we would say use the statin or the meds synergistically. What we do also know is that statins won't cure the cholesterol. So it will helps prevent progression, helps control the levels, but it won't actually take it away. And so that's if you can marry the two, it'll be helpful. Great question. Yeah.
Okay.